Okay, this last little part is going to be shorter than the last part. We're going to talk about the CDC recommendations specific to COVID-19. Basic protective measures. Number 1, wash your hands frequently. Regularly and thoroughly clean your hands with an alcohol-based hand rub if water is not available, or wash them with soap and water. Washing your hands with soap and water or using alcohol-based hand rubs kills viruses that may be on your hands. So do it. Wash your hands. Wash them all the time. Get in the habit of doing that now. Maintaining social distancing, maintaining at least 1 meter or 3 feet of distance between yourself and anyone who's coughing or sneezing. We're going to even say 6 feet just to be safe, and maintain that 6 feet distance between anyone and yourself, except your immediate family that you live with. When someone coughs or sneezes, they spray those droplets from their nose or mouth, which may contain the virus. If you are within the range of that sneeze, you can breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. You want to avoid touching your eyes, nose, and mouth because your hands touch many surfaces and can pick up viruses. Once your hands are contaminated, they can transfer the virus to your eyes, nose, and mouth. And from there, the virus can enter your body and make you sick. You want to practice respiratory hygiene. You should do this all the time, by the way, all these things, not just for COVID-19, but it's critically important that we do it for COVID-19. In other words, you cover your mouth and nose with a tissue, or if you don't have a tissue, use your bent elbow when you cough or sneeze, and then dispose of the used tissue immediately. Well, if you cough or sneeze into your elbow, the shirt you're wearing now has virus particles on it, so you need to take it off and wash it as soon as you can. Droplets spread the virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. If you have a fever, cough, and difficulty breathing, seek medical care early. You should stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority. So the Washington State Health Department is recommending that if you have symptoms, you call your primary doctor's office and they will tell you what you need to do and how they're going to collect samples or whatever they need to do. Don't go to the emergency room unless you're having difficulty breathing. And even if you are having difficulty breathing and you call 911, when you call, tell them that you may have been exposed to COVID-19. So calling in advance will allow your healthcare provider to direct you to the right health facility, and that'll help protect you and help prevent the spread of viruses and other infections. So it's really important that you don't just show up and hope that they can help you. Call and make sure you know you're going to the right place. You want to stay informed and follow advice given by your healthcare provider. So your local public health authority is probably the best authority for what's going on in your region about how you can protect yourself. So we don't know what's going on at the national level right now, but local authorities are stepping up, and so the local authorities are the best place to advise people on what they need to be doing to protect themselves. So adequate cleaning of your surroundings and clothing. You want to sterilize stuff. You want to use disinfectants and antiseptics. And like I said in the last part of the lecture, the CDC recommends for home disinfecting 1/3 of a cup of bleach in a gallon of water, also known as 80 milliliters of bleach in 4 liters of water, or 20 milliliters in a liter, which is 4 tablespoons of bleach in a quart of water. You're going to use that to disinfect surfaces. So the clothing that you're wearing when you're outside, like say you need to go to the grocery store, you need to pick some stuff up. As soon as you get home, you should change your clothes and wash them. If you're working in the clinic, come home and wash your clothes. When I'm at the hospital, I have shoes that I only wear to the hospital, and I don't bring them in the house. I leave them outside and on the porch and until I can wipe them down. And I take off my hospital clothes right away and wash them right at the back porch. That's where I do it. So you don't want to bring stuff into your home if you can at all avoid it. Sterilization of equipment in the hospital is usually done either by chemicals, so disinfectants, or heating in an autoclave, and that is, you need specialized equipment for that. Antiseptics are used on skin and tissues, so the hand rub, that's antiseptic. Disinfectants are used on objects or surfaces. So alcohol-based hand rub is an antiseptic. Bleach is a disinfectant.